So sorry, just give me 2 seconds. Okay, so welcome everybody to this workshop on strengthening civil society's role in health advocacy. My name is Abby Bejo, and it is a pleasure for me to welcome you today. So good morning, good afternoon, wherever you're joining us from, good afternoon. So Lake Health and Wellbeing is a public health NGO based in St. Kitts and Nevis, and we aim to improve the health and well-being of our local community through research, through public health interventions, through campaigns, and through events like this. So today, as I said, we're focusing on public health advocacy. And so the aim of today is to strengthen civil society's role in health advocacy by providing guidance on how to develop, implement, and evaluate advocacy campaigns. So this workshop is a two-part workshop. So today is part 2 of the workshop. So in part 1, we had a really nice introduction into public health advocacy. So we had Rachel Morrison, who gave us an introduction into health policy advocacy and the role of civil society. Francine Charles provided us with some information on developing an effective advocacy campaign. And Danielle Wall will talk to us about stakeholder engagement and mapping. And then Jill Greenberg spoke to us about using digital and traditional media as advocacy tools. So today we continue. So we're going to start off with Dr. Shelly Trim, who is the Development Coordination Officer of the Office of the UN Resident Coordinator, and she will be talking to us about the importance of monitoring and evaluating advocacy campaigns. We'll then kind of move on and use sugar-sweetened beverage advocacy as a bit of a case study and explore some of the lessons that we can learn from SSB advocacy and policy development. So we'll start off with Maisha Hutton, who's the Executive Director of the Healthy Caribbean Coalition, and she will talk to us about the need for action on SSBs in the Caribbean. We'll then hear from Shirley Ewan, the Advocacy and External Engagement Specialist Officer from Gate Field Impact. And Shirley will talk to us about the lessons learned around the role of civil society in the introduction of an SSB tax in Nigeria. And then finally, we'll hear from Dr. Marissa Carty, who is the NCD Program Coordinator at the Ministry of Health here in St. Kitts and Nevis. And Dr. Carty will talk to us about the process that they are going through in terms of developing a federal SSB policy for St. Kitts and Nevis. So in essence, we'll get a bit of the government perspective. We'll then have a discussion and Q&A, and this will be facilitated by Iceline Phillip, who is our Advocacy and Research Officer. Halfway through the session, so about an hour into the session, we'll do a little fitness break just to get ourselves moving, and that is courtesy of Danielle Wall from the Healthy Caribbean Coalition. So just a little bit of housekeeping before we get started. So everybody, all participants have been muted and your videos have been turned off just to prevent any disruptions. So, but feel free to use the chat box throughout the session for questions, comments, and discussion. And then questions will be answered by the speakers during the Q&A session at the end. If you'd actually like to speak during the Q&A, you can raise your hand and then we can unmute you so that you can actually speak as opposed to typing your message into the chat box if you prefer. So the session is being recorded and the recording will be available soon after this session. So without further ado, I am going to hand it over to our first speaker, and that is Dr. Shelly Trim, and she's going to talk to us about, she's going to talk to us about monitoring and evaluation. So over to you, Dr. Trim.
Hello, good morning. Just want to make sure that you can see my screen.
Yes, we can.
Okay, great. Thank you. I'm very happy to be here. Thank you so much, Abby. And thank you to Rachel Morrison, who asked me to help participate in this. And I, even though I work for an international development partner, one of my favorite things, which I don't get to do a lot of actually now, is really talk to persons on the ground. And just wanted to let you know, despite what you hear, I'll just put on my video for a quick second. Despite what you hear, I am a Jamaican, so don't let the accent fool you, because I saw you had the Jamaica thing and you had a little USA underneath it. So I'm a bit of both, but I just wanted to say hello and good morning. Thank you so much. So today I'm going to speak just a bit on measuring success, the importance of monitoring and evaluation in advocacy campaigns. And So the objectives of today's session really is to recognize the importance of monitoring and evaluation, discern how advocacy, monitoring and evaluation is slightly different from programmatic monitoring and evaluation, to help understand the challenges and approaches in monitoring and evaluating advocacy campaigns, and understand the basics in developing a monitoring framework. Now, this really, as you can see from what's there in the yellow, on the top of that pyramid is your voice. So today, but today it's going to be our voices. So I've asked Abby for some help for persons to raise their hand anytime I have some questions, since I won't be able to see the chat or the persons raising their hands. But first, let me ask you, have you ever been part of a training or a learning session on monitoring and evaluation? Could you please raise your hands? And Abby, tell me how many persons can have raised their hands?
Let's see, so far, no, one person. Oh no, okay, we've got two people.
Okay, so I see three.
No, three
have raised their hands. Okay, so usually CSOs, especially within the last couple of years, have really, other agencies have been really focused to ensure that persons understand the importance of monitoring and evaluation. Some of this may be new to you, but we can always ask questions, and I'll always be happy to come back and do another session breaking down some of the concepts we have today. But so your voice that you're hearing, and this is, like I said, your voice and my voice will be part of it today. And as we're thinking about advocacy campaigns, we're really going to think about the example of the You're Sweet Enough campaign being done in St. Kitts and Nevis about educating the public about the dangers of sugar-sweetened beverages and help mobilize persons to drink water, with the objective of the adoption of SSB policy and taxation in St. Kitts and Nevis. So tell me, and if you don't mind, if persons can either unmute, or if you can tell me what's held in the chat, what is monitoring and what is evaluation? What is monitoring first? Anyone? I know Abby, is anything? Okay, so I'll just go ahead. Monitoring really is about observing and checking the progress on quality or over the progress or quality of progress over a period of time. Evaluation is making an assessment of the achievements at the end of an intervention or initiative. So why do you think then monitoring and evaluating an advocacy campaign is important? Anything in the chat you would want to share, Abby or anyone?
Oh, to assess impact, let's see, somebody said, yeah, to assess impact is in the chat.
Yes. So yes, assessing the impact of what you're doing, how you're making sure whether or not you are making any strides or if you've made any progress in changing persons' attitudes, behaviors on a particular topic of interest. So monitoring and evaluation advocacy is important because it enables you to understand what factors and what approaches led to change. It helps to improve learning or help to improve your strategies if you are monitoring on a regular basis. And finally, it is important for accountability. You are accountable to donors, internal and external stakeholders. Being able to evaluate or to assess whether or not you've made any achievements on your initiative is important. So those are the three main areas of why monitoring and evaluating for advocacy is important. Overall ongoing monitoring or use of real-time information or evidence is important because sometimes the context changes, political opportunities can change, which may require some course correction or help to revise your strategy quickly. If you're monitoring regularly, you'll be able to see what changes may be going on. So how is advocacy for monitoring and evaluation different from programmatic monitoring and evaluation? So the design of advocacy intervention usually determines the use of monitoring and evaluation approaches used. And the main difference really is the kind of indicators that measure and track your progress. Now, one of the main objectives of the Same Kids campaign is to see policy change. As some of you may know, policy change can be a long-term process, and those changes may only become apparent even after the end of an initiative. Sometimes decision makers who may be the direct targets sometimes can be adversaries, and that's just a reality. And it's not just for advocacy campaigns, but for other types of interventions as well. But this may have implications for data collection and getting honest feedback. So these are things you should consider when putting together your framework. So who do you think is responsible for monitoring an advocacy campaign? Put it in the chat, where if anyone has anything, Abby, maybe you can help tell me if there's any responses in the chat.
Yes, so someone said everyone on the team is responsible.
Any other responses?
Those implementing the campaign.
Mm-hmm. Well, I would say
M&E officer, or if you're lucky, a dedicated M&E officer.
Yes, definitely. Or a program officer. So the person responsible for monitoring campaign can be that dedicated M&E officer, but they also would be working anyway in conjunction with the program officer. And usually sometimes in CSOs, it's the program officer who is often responsible for monitoring a campaign. In addition, you have internal stakeholders or project boards and committees that may be supporting the CSO in a particular initiative. They also are responsible for helping to monitor. This way, the M&E officer or the program officer may develop the monitoring framework, and they can advise on and determine what data collection methods and tools might be the best to use. But also those project boards and committees also help to ask critical questions to help assess the strength of the evidence that you have and that you collect during your data collection activities. What are the challenges in monitoring and evaluation for advocacy? Put your thoughts in the chat. If you think there are no challenges, or you're good, or there's so many challenges, just name a few if you think of any.
Accessing data, especially baseline data.
That's a very good one, accessing data. What else? Anything else? Oftentimes human resources to carry out the M&E. So having the personnel, I guess, and the expertise in-house to carry out M&E. Somebody else said developing appropriate indicators. Very good, yes, absolutely. That can be a challenge as well. When I was thinking about what are some of the challenges, and especially in monitoring or evaluating advocacy campaigns, one is determining and proving the links between policy influencing activities or the work that you're doing and the actual policy changes. Excuse me. Sometimes you can't know with absolute certainty that your campaign caused the policy change. How far can we actually attribute these changes to your particular intervention? Sometimes can be difficult, especially if You have other donors or CSOs who may not be part of your coalition or network, advocating for the same things, maybe in different ways. As mentioned before, getting honest feedback from target groups, like if your target group is a policymaker or other target groups, can be subjective. So their degree of influence sometimes is a challenge. Different stakeholders have different perceptions of influence. But what constitutes influence? How significant is it? What can you do to overcome it? So what are some possible solutions? Any feedback, and provide your feedback in the chat. So what do you think are some possible solutions, especially related to these challenges? Any comments?
It's quiet in the chat right now. I think
It's
people
quiet.
are thinking.
What about, yeah, but what about other members who are participating? Some of the other speakers, what do they think are some possible solutions? Or what do they think about some of these challenges?
I can only say a solution is training. And we're doing it today.
That's right. That's right. And I just wanted to know, even from the St. Kitts team, how many actually already have or have seen a developing framework? You have a development framework. Do you have a framework already established?
Like a monitoring and evaluation framework?
Yes.
Yeah, kind of, yes.
Okay.
It's probably not like perfect.
Okay, yeah. Hey, remember, a monitoring framework is a living document. It requires persons to look at it regularly and to make maybe some fine-tuning or some adjustments during the time period of an intervention. And when I asked you, okay, you say you have a framework, where do you keep this framework? This monitoring framework?
On our shared drive.
Okay, that's good. So you have it on a shared drive. Sometimes people print it and have it on their desk. But I always advocate for putting it somewhere that everyone can see. It should be a constant reminder of what you are measuring and looking for. It helps to remind you also in terms of frequency of data collection and other things that may keep you focused on what you're really monitoring and not getting dissuaded or too far off on what you're supposed to be doing. So I always like to keep, and I always like to see when I'm doing evaluation, is to see that somewhere that document is accessible to other members of staff, and it can be seen, especially in a program officer's office, either on top of their desk or somewhere on the wall, something that is a constant reminder and focus on what you're doing. So some solutions, as we talked about, is to develop this monitoring framework. It's important to track and measure your outcomes and document those incremental changes or progress towards your objectives. Like I said, documenting activities and having multiple sources of evidence is important to make sure that even in the end, when you're trying to answer the question about how did our intervention create that change, if we see some changes happening. And use policy experts as sources of information. You might collect information from experts, and especially those not directly linked to the policy progress, so that they can give you unbiased solutions or thoughts on the interventions, and maybe supply alternatives to thoughts about how you do your intervention and what is actually happening maybe on the ground. So you can think of thought leaders such as the academia or persons in the private sector may be good experts to go and ask sometimes for solution, let them know what you're doing, and trying to get their sense of what's happening on the ground. Sometimes private sector persons are closer to political advocates or policymakers themselves, so that they might know a little bit more of what's going on the ground. So a monitoring framework, it helps to define your objectives, tells you reminds you what you're trying to achieve by the end of the advocacy and intervention. Items in your monitoring framework should be SMART, and persons might remember that acronym as being specific, measurable, achievable, realistic. It has resources and is time bound. Using the example for St. Kitts, one particular objective that can be, or an outcome can be, the government increases taxes on sweetened beverages by 20% by 2023. It's specific because you're talking about the government, it's measurable, you're talking about increases taxes on sweetened beverages, by how much, by a particular time period. A monitoring framework also can help you define those long, intermediate, and short-term outcomes. By long-term, we mean those long-term changes in existing policies or the development of new policies, right? For intermediate, it means actually changes in knowledge, behaviors, and attitudes. And by medium or short-term outcomes, that usually measures progress changes, like some of your activities, like the establishment of coalitions or networks. You don't need an indicator for every activity that you do. That, in a sense, becomes too overwhelming. And you may have a particular objective that will encompass several activities. So overall, what you're measuring should be all of those, what you think those changes will be overall. And how do you do that? By choosing good indicators. You have process or output indicators that really measures the progress against specific operational activities. Like I said, those are medium or short-term progress changes. And then you have outcome level indicators, where it measures changes in the medium to longer term. Indicators can be qualitative, meaning that they measure attitudes and perceptions, and they have a different type of data collection, usually done by focus groups or in-depth interviews. Or it can be, indicators can be quantitative, meaning that it's numeric. You're actually following a number, like number of messages in social media. Sometimes a good monitoring framework can use both types of indicators, but it really also depends on what you've budgeted for data collection. Here's an example of advocacy-based long and intermediate outcomes. So long-term outcomes really could mean that overall, what your overall goal is, your long outcome, and where you overall want to assess your achievement means the change in policy or change in legislation. Another related long-term outcomes are based on those objectives that you've already described in your campaign. The evidence of a budgetary commitment. Is it there in the books that that tax increase is going to happen and when? And then you'd want to see for longer term outcome is the implementation of those commitments. Did the policy pass? So, and they said they're going to increase taxes. When are they going to commit that? It's important to continue to look at those longer term outcomes. But what's easier to measure and very important are also your intermediate outcomes. And those can be also be the reflections of what you're doing. So by building coalitions, making sure, or as part of your activities, you know that you are creating new or stronger networks and they're effective in their activities. It can also mean shaping the policy agenda, incorporating, you want to see what's being incorporated during your intervention in the discussions, what's being covered in the media, Once you know it may hit media, including social or traditional media, you might see policymakers willing to have a discussion on it. It could be political, or you might want to see what's also being discussed on social media. And that's a good way, and that's a good, it's an important then, even to when we're thinking about indicators, but tracking what's on social media now. Even once you find out if it becomes a trending topic on social media, it may influence your news programs or shows. All of a sudden, you're having a different type of forum, being able to discuss the initiative. In addition, you're also in the process, one of intermediate outcome can be building the social movement, where communities are inquiring new information, there's changes in attitudes, changes in behaviors, and other external stakeholders may want to get involved. In addition, you have the influence of policymaker attitudes and behavior. So it's good to keep your ear on the ground. That's why, like I said, you can have some of those other external stakeholders being able to say, oh, you know what, even though a policymaker may not be talking publicly, but there are having some discussions. You may not be privy to all those discussions, but it's good to know that somehow you are making some, you're making some influences over those attitudes and behaviors themselves. So we'll describe just a little bit on examples of advocacy indicators by the indicator type. We talk about processor output indicators. Again, this is assessing the progress against specific operational activities, number of coalition meetings, number of people trained, number of meetings held with policymakers, number of people contacted with a campaign message. And like I said, on social media, maybe the number of likes based on your discussion, and maybe what's trending hashtags. If you create a campaign and you put it on a YouTube site, it's always a good way to also check how many views it has received. And that can be part of your discussion and part of what you're measuring in terms of your process. Again, we talked about outcome. These are measuring changes in the medium to long term, right? So this can be towards your overall objectives, such as policy and funding changes or changes in attitudes. Some intermediate outcomes for advocacy campaigns can be number and type of supported communications or statements made by policymakers. So again, when we're talking about baseline, when did you start? Has anybody been talking about SSB and changes in policy or taxation related to that? Maybe that won't be any, but it's going to be important for you to take a look back, maybe a year or two, see what's trending, what was trending in the media at that time. And then you start counting once your initiative begins. We can also look at indicators related to the number and type of actions taken by local citizens. You know, if there's a referendum on the taxation issue, how many people are going out to help support that vote? You can look at the increased number of consultations on the issue and the increased number of media articles on your intervention. So measuring some of those things can tell you, you are making a difference and there are changes to be seen. Longer term outcomes really goes to the overall goal and what you say it's set as your overall objectives for your initiative. So you want to see that policy passed or a law ratified, and that is an indicator itself. You know, you can actually, your specific indicator related to policy could really reflect how a policy is introduced and what gets it to being passed or how that law is ratified. I know in areas sometimes you have a white paper, then you have a green paper, and then it's sent over for legislative review and language before it becomes a formal policy to be voted on. You can measure all of that as part of an indicator. Another longer term indicator could be the increased level of financial resources in a budget for an issue, like that percent increase in budget allocation or that percent of taxation that you wanted to see passed. So for all of the indicators though, you need to set those baselines and targets. Really, sometimes baselines, yes, can be difficult to get. That's why it's important that you do it really early at the beginning of your initiative or your intervention. And you take the time to dig and to look around you and see what has happened before on this. And that can help you to set those realistic baselines. In terms of targets, I always say targets should be a mix of reality and ambition. Sometimes it's hard to find that balance. You'll find out sometimes if you choose a target that's too low and you achieve it within the first 6 months, maybe that wasn't necessarily the best target to choose, and maybe it's not necessarily reflecting your longer term outcomes. So choosing targets also, a good target is important, that it's realistic and pushes you for that achievement. When you create your monitoring framework, it's important to think about your sources of data and your data collection methods, right? Where are you going to get this information? How you're going to get that information? And choosing those data collection methods, and this is a big flag for me, is also making sure that you set those budgets for data collection, as well as timelines for frequency of monitoring and achievement. So you say, okay, we've been doing a lot of work with policymakers, or we've been doing a lot of work for public. We're going to go out and do a survey and try to collect information on changes in attitudes or knowledge on the on sugars, those sugar-based or sweetened beverages. Does that mean if you decide not to do an online survey, but you actually have persons in the field, have you set a budget, thought about how many data collectors, how far on the island are you planning to do this? Is it just town central, whoever is close to you, or are you going to be looking all over the island? Set your budget then for data collectors and gas for the car or transportation that you may have to get those data collectors there. Time for data analysis. Who's going to do the analysis? Do you have any data analysis software that you're going to use to be able to analyze that data or survey data? And all of these have to be set within timelines for frequency of monitoring. So we're going to collect information once a year about attitudes or knowledge, and it really depends on the number of target groups you're going to do. The same survey that you may do with the public may not be the same survey, of course, that you do with policymakers. How many policymakers? Where are you going to get them? What about your focus groups? Focus groups have implications for data collection as well, and your budget. Focus groups usually need a facilitator, a note taker, something to record the session. Usually, of course, you're going to have refreshments, at least beverages for your participants. Where is that going to be located? Do you need a private room? Where can you get that? Or can you get that for free or easy cost? So I just wanted to make sure that I flag this for persons developing your frameworks and thinking about the types of indicators and your data collection methods and your timelines. So if you want something by the end of the year, you're not going to start data collection in December. Nobody's going to answer you. Christmas time, people are busy, maybe not November, September is back to school. Think about what would be the best timeline for collecting that information. just so that you can have it when you said you're going to collect that information and have a sense of where that indicator is at in terms of achievement. So in summary, monitoring and collecting information and evidence is important for advocacy interventions and campaigns. It can tell you about the type of change that you're making, where else you might need to intervene. And we also know that there are a number of challenges. So advocacy is influenced by many factors, and it may be difficult to attribute success solely to your work. That's why having a monitoring framework is important. So you can say, actually, we did this. This is where we did it. We collected information on it. These were the results. Documenting activities by collecting from multiple sources of evidence helps to track change towards your objectives and really helps to identify your contributions. Developing that framework, setting your objectives, your outcomes, your indicators, and sources of data collection is important, as well as frequency of data collection. But I think most of all, in terms of advocacy campaigns, stay positive and committed to the change that you believe in. And that is the end of my presentation. Thank you for listening and participating. And if you have any quick questions, I'll be happy to answer now.
Wonderful. Thank you so much, Dr. Trim, for that very comprehensive and informative presentation. Really, 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 really helpful. Lots of food for thought. So I know Dr. Trim has to leave early. So if anybody has any quick questions for her, I think she can take one or two now. But otherwise, we'll save questions until the Q&A. So any quick questions? So people are saying, thank you, very informative.
Yes, good.
Enjoy the presentation, thank you.
Okay, and happy to come back if you want any further or in-depth support in developing those frameworks. And
wonderful.
Evaluation. I did want to say that I didn't really focus a lot on evaluation for advocacy campaigns, as you may have seen. But what I would say is for evaluations, make sure you budget for it. The strength of an evaluation is increased when you have an external evaluator or someone who was not part of the initiative, who can be unbiased. You also, when you are doing this process of data collection and having your monitoring frameworks, make sure your evidence or your documents are kept straight. And it's in good working order, because sometimes even an evaluator for CSOs may have that in mind. How well prepared are they for the evaluation? Have your things ready and put them available for that eventuality of an evaluation. So even though you say, well, this was done and things are really busy, do take some time to make sure that all of those pieces of evidence and your frameworks, even the several iterations of them, if that happens, are available for viewing. Don't be afraid of the evaluator. I have to say that. They're not there to see what you didn't do. They're there to show really how your initiative or your intervention was successful, and you'd be able to do that. So if there are no more questions, thank you again. And I really hope you have a continued great day and this really great workshop. Thank you.
Wonderful. Thank you so much. We really appreciate your time and all the thought you put into the presentation. Very, very informative. Really, really good. So thank you so much. So we'll now move on to our next speaker. So that's going to be Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition. And so now we're kind of transitioning a little bit into sort of a case study around sugar-sweetened beverages and ultra-processed foods. So Maisha will talk to us a little bit about the need for action on sugar-sweetened beverages in the Caribbean. So over to you, Maisha.
Hi, Abby. Thanks very much. And Dr. Trim, I really enjoyed that presentation. One of the issues that we've always had with these advocacy initiatives is how do we actually confirm that we're achieving something when we are not achieving the policy change that we hoped within, the short period of time. So I thought that was really useful. So I am talking today about the experiences that we've had at the Healthy Caribbean Coalition and our partners advocating for healthier food environments. Let me scroll to the next slide. Right. This is an image I wanted to start with. It's from one of our recent campaigns, a joint campaign, and it really is kind of at the heart. We could probably replace children with Caribbean people, but really, we need healthy food policies because we deserve better. And the image kind of encapsulates the environment that we live in. It's so highly obesogenic, with triggers for the consumption of unhealthy food everywhere we turn. So what's the situation? And many of you know this, so I'm not going to spend too much time on it. Wasn't sure of the audience, so I put some additional detail here, and the slides are available for anyone who'd like them after. I think that the one thing I want us to remember as advocates is that unhealthy diets are really the #1 risk factor for obesity and NCDs. So when we're talking about NCDs, where we know in the region, 75% of mortality, 73% of premature mortality, people in their productive years of life, we're really talking about consuming these unhealthy foods, which are largely ultra processed foods, a big chunk of which we import into the region. Our environments are so obesogenic. They're not designed for health, as we know. They're really designed to encourage consumption of these unhealthy foods. And COVID, as we've seen from recent data, has really exacerbated these environments, right? And we've seen jumps, almost doubling in obesity rates of children. Data has come out from the US and the UK, and we've seen it in the region, anecdotal evidence from pediatricians and other doctors. They're seeing that, that these changes are happening and have been exacerbated by the pandemic. So we need to prioritize healthy food environment policies. And I think the emphasis, although we are talking about SSB taxation, we always need to remember that the policy package is the most effective, because no one policy is going to be a silver bullet. And in terms of the regional framework, there's the CARFA 6-point policy package, which really quite early on laid out this comprehensive set of policies which we needed to change and modify our food environments to bring children and adults towards healthier weights. And central to those are mandatory octagonal high and front of package warning labeling. So some sort of warning labeling. The evidence shows that the high end label is the most effective. Fiscal policies, this is talking about taxation on sugar-sweetened beverages, or more broadly, ultra-processed foods. Subsidies on healthy and minimally processed foods, including fresh fruits and vegetables. And then regulating the sale and marketing of these items in and around school settings, and broadly other settings as well. We've seen across the region some of these policies which have targeted schools have also addressed health facilities. And I wanted to just touch on this for a moment, the importance of front of package warning labeling as really a kind of an enabling and foundational policy, because it really enables us, once those packages are identified using an agreed nutrient profile model as unhealthy, or in the case of the octagonal warning label, high in these critical nutrients of public health concern, sodium, sodium or salt, sugars, fats, then we know that these foods need to be regulated, and regulated either through fiscal policies or through marketing regulation. So the front of package labeling is really meant to be kind of the core. Now, we've been working on that and we're not there yet. So in the absence of that, regulating SSBs is a really good start. And why is it a good start? Well, SSBs are one of the major dietary contributors to sugar intake. And we've seen this from research abroad, and we've also seen it from regional research. There was a study done in Barbados on dietary intake. It was published last year, and it found, again, replicating this data, that sugar intake from SSBs is really the major contributor to sugar in diets. Import data from the OECS has also supported this. Consumption levels of SSBs also in the Caribbean are higher than in many other countries across the globe, both amongst children and adults. And then for practical reasons, right? So in the absence of an agreed nutritional labeling system, what we just spoke about, and a nutrient profiling system, SSBs are relatively easy to identify and regulate. And then once you've identified them, then the options are fiscal policies or restrictions on banning and sale and marketing. And then taxation works, right? We know from experiences with alcohol and tobacco that taxation is one of the most effective mechanisms of regulating consumption of these unhealthy commodities that we don't want the public to consume. And years of taxation on tobacco and alcohol have demonstrated unequivocally that they reduce consumption, especially amongst early initiators, young people. The WHO recommends SSBs to be taxed at a rate of at least 20% in order for the policy to be effective and to achieve the intended goal of reducing consumption. Taxes also generate additional revenue, and that revenue can be redirected towards healthy programs to improve healthy behaviors. At the moment, as we all know, there are only 3 countries in the Caribbean that have implemented SSB taxes as a health measure. Barbados was at 10%, and it's now will jump to 20% shortly on April 1st. Bermuda is the highest tax in the region and amongst the highest in the world at 75%. And Dominica, around the same time Barbados did back in 2015, announced a 10% tax. Their tax covers more than just SSBs, however, as Bermuda's does, and covers some unhealthy foods as well. So Caribbean advocacy for healthy food environments, what are we getting right? And this is really, this is drawn from the advocacy really around front of package labeling, around removing sugary drinks from schools, and around SSB taxation advocacy in selected jurisdictions. And one of the key success factors is really building strong, diverse coalitions of credible actors, each with their own unique strength to add value to that coalition, whether it's the credibility of the public health authority, the regional public health authority, or the National Public Health Authority or Ministry of Health. That's really critical, whether it's community leaders, whether it's lawyers who can provide legal evidence, economists who can speak to the economic impact of the tax, parent-teacher associations, so those who are most impacted by these policies, young people living with NCDs, academics doing the research. Building strong, diverse coalitions is critically important. It also provides, it's also very protective in the sense that once people feel that they are part of a broad and growing and a strong coalition, they are more likely to be vocal in their support. They're more likely to feel freer in terms of when they're countering interests which may be opposed. Generating and fostering high-level support. So this is hard work. And really what I'm talking about here is working with policymakers and really trying to bring them on board through the evidence, but also recognizing that they have their own political restrictions. So working with them, understanding, listening, but trying to bring them on board slowly but surely is really, really very important. Developing tools, whether those are tools for policymakers, we've developed legislative guidance this is model policies, counter argument fact sheets, so that when they're in private rooms speaking to those who oppose certain legislations, they have the evidence at hand. And this applies to advocates as well. Advocacy guides, evidence fact sheets, and again, those counter arguments, which are close at hand to respond to those who oppose these policies that we're promoting. Disseminating the evidence, and you'll find that you repeatedly have to do that over and over again. And also when we're talking about evidence, because we've seen recent research being done in the region by entities from the private sector, we really need to think about promoting research that is free of conflict of interest. And that's really critical. Educating the public, we really need the public to be on side, and the Sweet Enough campaign was brilliant. And so using various communication channels and communication materials to educate the public. And then a key part of that too is who can you get on that campaign? So when the public sees the campaign, it's not only just you as a civil society entity, but they're seeing also, the Ministry of Health is on board as well. Local organizations who are seen as credible and reputable and influential in the community. Monitoring the policy process in an ongoing way so that you can monitor that policy process for transparent as a mechanism of transparency, and also to hold it accountable. Highlighting conflicts of interest. developing tools for managing conflicts of interest, and then finally countering opposition and interference. And we really need to be smart with the last one, because we are, when there is opposition, as we've seen now, I think maybe HSFB might be on the call, Francine, they've just announced the tax increase in Barbados, and there's very strong opposition, but civil society doesn't have the power and the influence that private sector does. So you really need to be very, very smart in how we oppose interference, and not get bogged down as well with repeated countering. Stick to the evidence, and make sure that those who are in positions of decision making have the evidence close at hand. Just jumping back up to that first point there about building diverse coalitions, one of the really effective things that has been done in Jamaica as well as in Barbados is including actors within the private sector who are allies, right? The private sector is not monolithic, and there are many allies within the private sector that you can bring into your coalition. That's a tough one, but it's an important one if it can be achieved. So what are the challenges? The financial and human resources within civil society. Advocacy is a thankless job if you don't have the benefit of funding, like a handful of us do across the region. Many of the organizations that we call on to support us at national level to really kind of push for these policies don't have the extent of funding that we have. And so that civil society capacity and staying power becomes that much more difficult when you don't have those resources behind you. And then we're up against a coalition of the powerful, well-resourced, well-mobilized, politically connected, who also have, they're very influential. And then there's also within our small societies, there's the boundaries between those entities are very difficult to draw lines with. So the company which may be manufacturing all of the water or bottling the water and manufacturing milk, for example, here in Barbados, also manufactures a number of SSBs. So it's very difficult to then, as you can in larger countries, say, we won't partner with these groups, or the conflicts of interest lie here, because it's much more difficult to identify where those red lines fall. Generating and defending the evidence in public health, I think for all of us will find that's something that we keep doing over and over again, often having to repeat the same evidence, and that becomes very exhausting. Constantly defending and having to disentangle the counter arguments, which are often, have often been manipulated to serve a certain purpose. National and regional public health governance architecture, a lot of porosity within these processes, conflicts of interest, power imbalance. That's a really tough one, but it's something for us to be aware of. And then, of course, competing political priorities, COVID, but that also presents an opportunity. And that brings me to the last slide. So, there's regional policy momentum. We've seen countries across the region. Since 2016, the heads have, in their communiques, been very vocal about their acknowledgement of childhood obesity as an issue. Way back when we were the first region to acknowledge NCDs as a development issue with the seminal Port of Spain Declaration. So we know that there's a high level awareness, but I think we've started to see in the past few years an uptick in momentum. We've seen St. Kitts this year committing, to implement this SSB tax this year. We've heard the same from Antigua. We've had, a number of countries announce school policies. And I think there's also a recognition that they need to be implemented as a package, but we're doing it step by step. So we need to build on this momentum. We're a region in that ecosystem of CARICOM, possibly we can get the dominoes to fall. So I think that momentum is really important as an opportunity. My time, I'm telling you, I've got a minute left. Okay, there's a growing body of evidence, and there's increased interest and capacity for regional research. We saw regional research in Jamaica. And so we need to cultivate that as best as we can so that we have not only international, but internal research. There are vocal champions from key spheres of influence that we need to leverage and try to build that base. These partnerships are very important, whether they're national, regional, or global. And we need to leverage those for the experiences that we can draw from other settings to influence the work that we're doing. There's synergies across other areas. COVID increased engagement on food systems and food insecurity. Even in the last heads of government, there's a clear recognition that food insecurity is a major issue. We need to take steps to address that insecurity. And then there are links with climate change in the food system that we need to draw on as well. And how can we partner with those advocates in those communities? There's an increasing capacity of civil society to effectively advocate and counter interference. And that's a real plus and something that we need to build on. And then finally, and I think most importantly, is this regional coalition of diverse actors working together in concert. Again, we think about this ecosystem that we live in. Yes, we are 15 to 20 sovereign countries, but we're also an ecosystem, and what happens in one jurisdiction influences the other. So this coalition that we're building, this diverse coalition of powerful actors in their own right, including the media, which cannot be underestimated, has been really effective. And I think we need to continue to build on that. And with that, I'm going to close with this slide, and thanks for having me. I hope that was useful.
Wonderful. Thank you so much, Aisha. That was really, really useful. A nice, really walk through of what's happening in the region, the challenges, the opportunities, and why we really need to take action. So because we've been sitting down for quite a while, we're going to just take a little movement break. And this movement break is brought to you by the wonderful Danielle Walwyn from the HCC. So just to get us moving and stretched, as we are all public health advocates. So we'll just get a bit active. So just going to share my screen, and we'll just do a quick movement break before we move on to the next presentation. So hopefully everybody can see, and we will get going.
Hello everyone, and welcome to our movement break, and we're going to be moving to one of our favorite jingles, You're Sweet Enough. You will need one thing for this movement break. Water bottles, so I'll give you a minute to grab that. And as you're grabbing that, just a reminder to check in with yourself, because we're going to be moving, and we know the positive associations with movements, even a short little movement break like what we're about to do. Are we ready? Have our water bottles in hand? Okay, so I'm going to invite everybody to stand up, and we're going to be doing some brief movements with our water bottles to one of my favorite jingles. Ready?
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science sugar low is fat, but don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey. Hold on, stop. Think about the
Hey, see, very convenient. Have a sip of that water. Awesome job. Take in how you're feeling right now, and enjoy the rest of the program.
Wonderful. Thank you, Danielle, for providing us with a little fitness break. So I hope everybody got up and got moving. Okay, so we're now going to move on to the next speaker now that we're feeling a bit more revived and refreshed. So it's with great pleasure that I introduce Shelly Ewang. So Shelly Ewang is the Advocacy and External Engagement Specialist Officer at Gatefield Impact in Nigeria. So Nigeria had a policy win earlier this year. So Nigeria just introduced a SSB tax. And so civil society played quite a big role in that. So we're going to hear from Sheila around the role of civil society in the introduction of the SSB tax in Nigeria and the lessons learned. So over to you, Shirley.
Thanks, Abby. I'm just going to show.
You're welcome.
Quick hi, everyone.
Hi.
Here, thanks, Lake Health and Wellbeing, for extending this invite to Gatefield. Without wasting further time, I would just go ahead and share my screen. All right. Okay, so I'm just going to provide some insights and overview of our sugar-sweetened beverage tax advocacy journey in Nigeria. So the title of my presentation, well, I'd like to call it as more of a case study, is Lessons Learned, the Role of Civil Society in the Introduction of an SSB Tax in Nigeria. So here we go. Seem to be experiencing some, all right, fantastic. All right, so to start, I'm just going to provide a brief overview of Nigeria's unique SSB tax and NCDs situation. Nigeria is the fourth highest consumers of soft drinks in the world. About 40 million soft drinks are sold each year in Nigeria alone. On the flip side, we have a really high diabetes prevalence rate. Actually, we're number one in Africa with about 11 million Nigerians being diagnosed with diabetes. And also the Nigerian government spends a lot of money on, diabetes treatment yearly. About $4.5 billion is spent on diabetes treatment alone in Nigeria. So putting all of these facts into view, Gatefield's impact goal was to advocate for the passage of a sugar-sweetened beverage tax in Nigeria by increasing policymaker and public awareness and support for the measure. Okay, so this slide just presents sort of another overview of our advocacy journey. So the project started in January 2021. We started off with coalition building. From March to December 2021, we carried out a host of different stakeholder engagement activities. We mounted a public pressure campaign in October to November. And in December, the tax was introduced. Actually, we rang in the new year with, this amazing news that the tax had been introduced in Nigeria. And in the new year, we started focusing on, defending the tax, countering opposition, and carrying out a lot of different activities just to ensure that there is increased public acceptance for the tax. So the first activity, like I just mentioned, was coalition building. And I think this is sort of sets the tone for the rest of my presentation. Now, we knew that in order to start this project and start this, great advocacy journey, we could not go alone. It was important that we leveraged on the expertise and experience of civil society in Nigeria. So we enlisted 10 public health organizations, 10 NGOs, and created the coalition called the National Action on Sugar Reduction. A few of our key coalition members are the Diabetes Association of Nigeria, Nutrition Society of Nigeria, Nigerian Cancer Society, Nigeria Health Watch, and Project Pink Blue. So they're a diverse group of actors that have unique experience and expertise in different areas of health advocacy and stakeholder engagement as well. So this is the first major role that the National Action on Sugar Reduction members played. They helped us to really understand the context of the issue. They brought practical and contextual knowledge of the issue to the forefront. Now, I mentioned the Nutrition Society of Nigeria. The Nutrition Society of Nigeria really helped us to understand, the harms of consuming SSBs. Even though we were already privy to a lot of research, it was important to have that contextual information from Nigeria and from Nigerian nutrition experts, right? And also they helped us to bridge the gap between the public and the policymakers. As we all know, collective action is central to, movement building and, just really defining the perfect approach for policy advocacy. So creating this coalition was really key in helping us define our strategies and defining just goals that are easily achievable to obtaining a tax on sugar-sweetened beverages. So the coalition, the National Action on Sugar Reduction, we had a single unified goal. All of these different actors and public health organizations were passionate, or are passionate rather, about improving public health outcomes in Nigeria. Nigeria Cancer Society works on cancer awareness creation. Project Pink Blue as well. And Nigeria Health Watch does a lot of beautiful health communications advocacy in ensuring that Nigeria's health situation is really at the forefront of policymakers. So all of these different actors coming together helped us to multiply the pressure and just helped us to facilitate the dialogue on the issue of sugar-sweetened beverage consumption in Nigeria. Now, the coalition, following up from the knowledge sharing slide, the coalition really helped us to set a core mandate for our advocacy project. So I would say to all CSOs that are present today, it's important to really outline what your goal is. That way you're creating steps and activities that would help you to achieve those goals. So agenda setting is the process of really coming together to bring about, powerful ideas that can influence change and, help with your policy advocacy goals. So the National Action on Sugar Reduction came up with 3 policy recommendations. The first was to introduce a 20% tax on sugar-sweetened beverages, actually a 20% excise duty on sugar-sweetened beverages. And the second was to create a health fund for NCDs prevention. Now, our goal was to use the revenue from the tax to create this fund because people that are living with NCDs are people that live below the poverty line in Nigeria, and treatment of diabetes, if you can remember my first slide, is really, really expensive. So it's only right that SSBs, that's a huge risk factor for NCDs such as diabetes. It's only right that the revenue that's gotten from that tax should be used to fund the prevention of NCDs in Nigeria. And lastly, we decided to also recommend that the government ensures that there is mandatory front of package warnings. So all of these 3 approaches formed our policy recommendations. All of these 3 goals rather formed our policy recommendations because the NASR coalition understood that a tax alone is not the solution. It's important to apply different approaches in order to meet the shared objective of the coalition. Stakeholder engagement. This is a really important aspect in any public health advocacy. Civil society really helped Gatefield Impact to interface and dialogue with the Ministry of Health and Finance and the National Assembly. And I just want to say that partnering with the Ministry of Health is super important. So however you can get your leg in the room to have a conversation with anybody from the Ministry of Health, I'd strongly advise you to do that because it opens up room for you to interact with the ministry stakeholders. And that way you're able to build your coalition. You're able to meet with people that have a shared interest in your in your policy advocacy. So we had a number of advocacy visits at the stakeholder engagement, which led to an invitation to the National NCD's policy review, where we were able to, insert the agenda of SSB taxation in Nigeria. And we, liaised and networked with different organizations such as the Nigerian Medical Association, who eventually joined the coalition. Civil society also contributed in expert webinars. One thing that we did at Gatefield Impact was we leveraged World Health Days to sort of, have dialogues on the issue and just really create awareness and educate journalists on the issue of SSB tax and why it's necessary and important for Nigeria's public health system presently. Also hosted a public lecture, which I would show you in the subsequent slides. And we had a tax motion. I'm just going to talk about this a little bit. So we secured a sponsor at the National Assembly, at the House of Reps at the National Assembly, to present a tax motion on the floor of the representatives. Now, this tax motion obviously had the SSB agenda included, but however, it was removed, but they resolved to pursue the front of package labeling recommendation. Now, even though the tax, which was our major goal, was taken out of the motion, we still saw the front of package labeling as a win, as a small win, and we continued to liaise with members of the National Assembly in order to see how far we can push this policy needle forward. So I talked a bit about webinars. So yes, to your left is a webinar that we held during NCDs Week, Global NCDs Week. we had different speakers, different expert speakers from our coalition. We had the National Secretary of the Diabetes Association of Nigeria, who, interestingly enough, is a person living with diabetes. And just really having him coming to speak from his perspective on the cost of treatment and, what it's been like for him was really, really important and insightful. We also had the president of the Nigeria Cancer Society really come to create more awareness on how we can come together as different stakeholders and members of the society to really tackle the issue of non-communicable diseases. Now, I mentioned partnership with the Ministry of Health. We also had the Deputy Director at the NCD's unit at the Ministry of Health come to speak as well, talking about what the ministry is doing to really combat the high rate of NCDs in Nigeria. And to the right, is a webinar series that we had after the tax was introduced. I'm going to talk a bit more about that, but this webinar was hosted by Nigeria Health Watch, who is one of our coalition members. Nigeria Health Watch was able to bring in different stakeholders that we didn't even have access to come and share their insights on how to come together to build a really strong advocacy campaign for sugar taxes in Nigeria. And this was also a way for us to counter, the opposition messaging that had been going around the media since the tax was introduced. So these are just pictures of some of the meetings that we had, but this meeting in particular was the public lecture that we hosted on World Diabetes Day. Now, I mentioned leveraging World Health Days to raise more awareness on the issue. And I think World Diabetes Day is a perfect day for civil society members to come together to really talk about the issue of NCDs and SSBs and how we can curb the rising rates of NCDs. We had the senior health specialist at the World Bank come and speak he gave a very fantastic presentation on SSBs and how we have to act now in order to ensure that this tax is introduced and how essentially it's a win for Nigeria if the tax is introduced. And at this meeting, we also had a lot of media organizations really come and cover the meeting to ensure that policymakers don't miss out on this important event, right? So yes, brings me to media engagement. How did the coalition leverage the media during our advocacy? We created a journalist network, and I think that this is really something that other public health advocates should look to do. So journalists were very, very crucial and beneficial to our advocacy efforts. So we created a journalist network. It wasn't anything too serious. We just formed like a group on WhatsApp. Different journalists from the major news houses in Nigeria, all in one place. So that was where we were disseminating all of our information, all of our press releases as a coalition, our communiques, as well as research, just to ensure that they have a certain level of understanding, and which obviously would also aid their reporting to ensure that they're not miscommunicating the policy agenda or the agenda of the coalition. So after we formed the journalist network, we also hosted a media webinar. Our coalition members championed that media webinar as well. We created a media toolkit just to ensure that messaging is consistent and they really have all of the resources needed to report adequately on the issue. And the coalition commissioned a ton of media stories. We had over 100 media mentions at the end of last year. And I think that says a lot with how we really leveraged the media to ensure that our policy ask wasn't lost in the agenda, because Nigeria is a country that has a ton of different problems. And to some policymakers, the issue of SSB taxation is not that important, but we use the media to pass the message that it is important and it can really help curb the rates of NCDs in Nigeria. So these are just a few news clippings of our media engagement. In the middle was a press release that we had put out after our World Diabetes Day public lecture. We garnered a lot of discourse and engagements on traditional media as well as social media. And we also harnessed the powerful tool of digital advocacy. So this is a public service announcement featuring most of our coalition members talking about how a carbonated drinks tax is a win-win for Nigerians. It's a win for health, it's a win for domestic revenue, and it's also a win for the economy. So I would say along, just really harnessing traditional media, it's really important that you leverage the power of digital media as well. Social media, Instagram, Facebook, WhatsApp, I think is also something that is often neglected when thinking about digital advocacy. But I think that that's also a really, really powerful tool in sending your information across stakeholders. Okay, I'm running out of time, so I'm going to be quick. So in November, we had to mount a public pressure campaign because following our World Diabetes Day public lecture, word on the street and among stakeholders was that the finance minister was strongly considering including SSB taxes in the Finance Act. So we knew that it was now or never. We had to, really show the finance minister that there's a lot of public acceptance for this tax and what you're doing is a good thing and you should go ahead with it. So what did the coalition members do? What we did was we decided to put out an open letter, which was published in 2 highly acclaimed news paper agencies in Nigeria. Now, this open letter was signed by not just the coalition members, but it reached a number of their stakeholders as well, local and international health organizations that had a shared interest on the issue. Another thing that we did was community mobilization. We had human billboards all over the streets of Abuja, but primarily in 2 major places, at the Ministry of Finance and at the Ministry of Health. So really just making sure that the call to action was in the face of the policymakers and the people who actually would have a say in ensuring that this tax really goes through and is included in the Finance Act. And on the 31st of December, following our pressure campaign, we heard the news that the tax had been introduced. And funny enough, the Minister of Finance referred to it as a health tax. So that really made it clear that all of our efforts as a coalition and as a diverse group of actors really, really played a crucial role in getting this tax introduced and hopefully implemented. So the soft drinks tax she mentioned was to boost Nigeria's fight against obesity and diabetes. So she saw it as a health measure because that's the message that we kept on reiterating in the media. And obviously the coalition had to respond because we knew that we had to be proactive. Knowing how powerful the beverage industry is, it was important that we continued to let the ministry know and the federal government of Nigeria know that, this tax is accepted, it's necessary. We applaud you for all of your efforts. So again, here are just some of the newspaper clippings of our press release that we released immediately after the announcement of the tax. And obviously there was a lot of pushback, exaggerated messaging in the media from private sector and organized groups saying that the tax is going to cause mass hunger, hardship in Nigeria, and it's going to worsen the economy. So obviously we couldn't stay silent. We had to counter opposition. So we brought back the human billboards, but this time around, we also brought some, human cardboards, just putting out messaging such as Coca-Cola, stop fighting the health tax, and thank you government for introducing this sugary tax. It's going to help us. We appreciate your efforts. We also commissioned a story, a news story in a newspaper as well, titled Saving Nigerians from Sugary Drinks. Now, this webinar that I mentioned, Nigeria Health Watch, was during this period of countering opposition, where we had different members of the coalition from Talk Health Nigeria, who is like a media organization that does like talk shows on health issues in Nigeria. Also, we had our partners from JHAI come and just give insightful presentations on how we can build a strong advocacy campaign for the sugar tax in Nigeria, because even though the tax was introduced, we knew that it was important for us to keep going and keep, ringing the alarm and saying, do not repeal this law, like this is important. So what's next for the NASR coalition? We are currently working on defending the tax because there is still a lot of opposition from the beverage industry and the organized private sector. We are trying to ensure that the tax is implemented. We're trying to have a lot of different stakeholder dialogue sessions, making sure that we are, giving some consultations on creating mechanisms for the tax to be implemented and for it to be used for the prevention and funding for non-communicable diseases in Nigeria. We're still continuing on stakeholder and public education. I feel like that's something that CSOs should never stop, even when it feels like you've achieved your goal. Like I said, the beverage industry is very, very powerful. So you have to still keep your messaging alive and adaptable. And like I said, yes, we're supporting efforts to implement the tax. So for lessons learned, this is my final slide. The first lessons learned from Gatefield and the National Action on Sugar Reduction is to ensure that as public health advocates, you always find a champion. Find a champion for your cause, find a champion for your advocacy goal, for your advocacy agenda, somebody that truly understands the importance of the issue and the need for this healthy food policy. If you can't find a champion, find an influencer, somebody that can influence policy, somebody that can, take you into those smaller private conversations with key policymakers. And another thing that we learned was to leverage political will. I actually forgot to mention this at the beginning of my presentation, but when the project started, Nigeria's Minister of Finance had already indicated, some interest in introducing a sugar-sweetened beverage tax at I think it was some sort of meeting with the IMF, because the IMF had, asked us to explore more taxation as a way of increasing our revenue. So we knew for sure that she was interested. So we leveraged on that. We knew that we had to keep on, creating more awareness and just really targeting the Ministry of Finance and all of the other relevant policymakers with our messaging and with our advocacy activities. So that's something that I think all civil society members should employ. Just really understand your political landscape and leverage on it. Find something that you can leverage on. And also target your decision makers. I think I've already mentioned this. Your messaging should obviously target the public because you need to gain their acceptance, but do not neglect targeting the decision makers with all of your activities and your advocacy messaging. And yes, adapt your messaging. Interestingly enough, we not only focused on the health benefits of an SSB tax when we started out in the project, but we also talked about the economic benefits and how it can be, a source of revenue for Nigeria. But because Nigeria and taxation is, it's really dicey when it comes to taxation, because at that time, the government had just introduced or increased value-added tax in Nigeria. So it was a very, very unpopular conversation at the time. So we knew that we had to adapt our messaging and just really focus on the health benefits, because that was more accepting from the public. And before I close, ensure that you're heard. Try as much as possible to shout in ways that people can hear you, your policymakers can hear you. Do not stay silent, even when, opposition is, using all of their power. Be heard, leverage the media, leverage social media, leverage your network, and just ensure that you are still being heard and you're still setting the stage for achieving your advocacy goals, because I believe that no matter how broad your goals may seem, they are achievable if you don't stop and you keep going. And yes, be armed with counter messaging and just try and be proactive with all of your activities and try to be a few steps ahead. And that's it. We made change happen thanks to our amazing coalition members, thanks to the Global Health Advocacy Incubator as well. And yes, that's it for me at Gatefield. Thank you.
What? Yay, you can't see me, but I'm giving you a standing ovation. Excellent, excellent presentation. Congratulations on a fantastic advocacy campaign. Really, really well done. Congratulations. And I think it's just brought to mind that I think it would be so wonderful to connect CSOs in the Caribbean with CSOs in Africa a bit more often so that we can learn from each other, because we're all doing the same things and we have so much that we can share and learn from each other. So it's wonderful to have you here today. Excellent,
Absolutely,
excellent
absolutely.
presentation, excellent campaign.
Thank you
So I know.
and apologies, I went way beyond my time, but
No, I think you are okay. I think you're okay. So thank you so much. I know you have to leave a bit early, so I don't know if anybody has any questions for Shirley right now before we move to Dr. Carty. We could just take maybe one or two questions. So does anybody have any presentations, any questions for, any questions?
I do actually, Abby, just
Okay.
one question.
Okay.
So, Shirley, you mentioned about having the government, obviously earmark the funds. How was that for you in your experience? Was there an actual commitment from the government to say that we're going to actually take this money? Because you talked about the NCD Prevention Fund. Was there an actual outright commitment from the government that they would use the tax revenue from in order to put it into a fund for NCD prevention, or at least diabetes control and prevention? What was that experience like for you?
all right, thank you so much for your question. I think that question is very timely. Like I mentioned, the Minister of Finance actually called it a pro-health tax to curb the rising rates of obesity. Now, personally, and I think I can say this for my team members, even though that was a win, we felt that that comment was a bit vague. So that's something that we're trying to do now. We're trying to have more stakeholder consultations with the Minister of Finance and the ministry at large to really understand what their measures are in implementing the tax, and hopefully just giving them some advice and consultation essentially on creating the right mechanism for the implementation of the tax and ensuring that the revenue is really geared and earmarked for the Ministry of Health. And the Ministry of Health is willing to partner with us on this. Like I said, the advocacy continues, it never stops. And I think this is just right where we are right now in our advocacy, just really ensuring that it's implemented the right way, because in Nigeria, we heard that, or rather from one of our consultations with the Ministry of Finance, all taxes go into one pool, but we know that that's not always the case, and there can be exceptions, because there are a few exceptions that exist in Nigeria with regards to taxing. So that's something that we're really pushing for, and I will keep you posted. But in terms of experience, I guess I was just happy that she referred to it as a pro-health tax. So that, I mean, the conversation still going.
Great, thank you so much. We're rooting for you always. Thank you.
Definitely, wonderful. So I think Francine has a question for you. So over to you, Francine.
Thanks a lot, Abby. Hi, Shirley. Congratulations. Excellent stuff. I just wanted to ask you two questions, because you kept mentioning about the implementation. Is it that the implementation has not occurred as yet? And is there a date? And then I saw the notes on the industry's reaction. What was your public reaction like?
Okay, so the implementation, honestly, we're not sure if it's been implemented, although the beverage industry has gone ahead to increase the prices of sugar-sweetened beverages. But I think that that's just a tactic in order to, really cause like an uproar amongst the public, and really just cause people to start, opposing the tax in general. But in terms of implementation, there isn't an exact date on when or if it's being implemented. But like I said, we're still trying to have some more conversations to really understand what's going on that front. And in terms of the industry opposition, I think even before the tax was introduced, obviously there was some industry opposition, but what we did was we leveraged the media and we just kept going. We also had an influencer strategy that I couldn't mention, but we leveraged different voices, not just public health advocates, but fitness enthusiasts and just, prominent people with a huge following on social media to really ensure that our messaging is out there. And, we just didn't let the opposition frazzle us. We stayed the course, and when the tax was introduced and the opposition came, we just responded as a coalition through human billboards, through community mobilization. So I think these are approaches that are very useful and was useful for us.
Yeah, excellent. It was really, really good to hear and very, very helpful. Thank you.
Thank you. I'm so happy to hear that. Thank you, everyone, for your kind comments, and thanks for having me again, Abby.
You're very welcome. That was really excellent. So thank you so much. So in the interest of time, we'll move on to Dr. Karti. So it is my great pleasure to welcome Dr. Karti. So Dr. Karti is the NCD Program Coordinator at the Ministry of Health. And Dr. Karti is going to talk to us, so give us a bit of the sort of government perspective. So she's going to talk to us about developing a federal SSB policy for St. Kitts and Nevis, and also hopefully give us a few tips on how civil society can work with the Ministry of Health. So over to you, Dr. Karti. And thank you so much for being here, Dr. Karti. I know you're busy, so thank you so much. And don't forget to unmute yourself.
Sorry about that. A pleasant good morning to everyone, and thank you, Abby, for inviting me to participate in this webinar this morning. I'm going to start sharing my screen now. So this morning, we just want to quickly share with you the process or the journey of developing our sugar-sweetened beverage policy in St. Kitts and Nevis. It was quite an interesting journey, actually, but one of the things we recognized is the importance of making sure that we get as many persons on board right at the beginning in order to ensure that what we put forward is exactly what we want from a Ministry of Health perspective. Now, one of the things I would like to share very briefly is the evidence that influenced our decision in developing this sugar-sweetened beverage policy. Now, in the Federation of St. Kitts and Nevis, non-communicable diseases are the leading cause of death. In 2015, from 2015 to 2019, what we have seen is an actual increase in the number of deaths attributed to non-communicable diseases. And one of the trends that we also recognized was that percentage increase, because in 2015, of the total deaths, 52.2% was attributed to NCDs, whereas in 2019, that percentage increased to 68%. Now, according to our 2019 analysis of the health in the Federation, there were three main leading causes of death: cardiovascular disease, cancer, diabetes complications. By the end of 2020, we recognized that the number of persons diagnosed with or diagnosed and registered in our community health system had also increased. And of those persons, 68% were female and 31.5% were male. So this is the type of information that we saw coming out of our analysis that basically gave us that push towards the development of the sugar-sweetened beverage policy. Additionally, what we also saw was between 2013 and 2017, there was an increase in the total amputations done at the hospital. But we do know that persons had amputations related to motor vehicle accidents and some other areas. However, majority of those amputations were from diabetic complications. As it pertains to overweight and obesity, from our 2016 analysis, we recognize that over 70% of our adults were considered overweight and obese. And for our children, this study was done in 2011. Unfortunately, we haven't done another global school health study as yet, and so we don't have any current information. But at that time, 32.5% of our children were overweight and 14.4% were obese. Additionally, we recognize that 61.6% of those students indicated that they drank a carbonated soft drink at least one or more times per day within the last 30 days. And of course, we know that physical activity is also a contributor to overweight and obesity, and only 25.6% of them had indicated that they were physically active. And so that was some of the data that we used to justify the development of the sugar-sweetened beverage policy. Now, in health promotion, there are three main ways in which engage in order to create effective interventions as it pertains to decreasing the impact of non-communicable diseases through program implementation, policy development, and legislation. And so what we're going to be focusing on this morning is our sugar-sweetened beverage policy development. Now, an integral part of health promotion is advocating of the availability and accessibility of consumption of safe and healthy and tasty foods. And though we tend to focus mainly on what we eat, it is important for us to recognize that healthy drinking is also an important part of the health education process. Research has indicated that the consumption of sugar-sweetened beverages leads to an increase in free sugars in the body and an increase in energy intake. And this is definitely linked to increased dental cavities in children and overweight and obesity in both children and adults. Now, the research indicates that there's a probable association to that weight gain, but we do know that if you do increase your intake of sugary beverages, if you do not expel that energy that you are taking in, then that energy is stored as fat, and therefore we can see where that association to weight gain can come from. And so we recognize that the implementation of fiscal policies such as taxation on sugar-sweetened beverages can help to reduce the consumption of sugar-sweetened beverages, as well as increase the consumption of healthy drinks such as water. And so what was our process? In 2017, we started the process by conducting a data collection survey. What we did was so we've conducted a data collection process in 2017. So what we did was we conducted a survey out in our food stores, such as grocery stores, shops, even those gas station stores. And we went in there and we determined the number of sugar-sweetened beverages that were being sold in those outlets. From there, we were able to send that data off to our PAHO advisor, who was at the time Dr. Tomakanda, and she also was working along with Lisa Powell. And they were able to analyze the data and send back a report to us here in country in order for us to use that report now for the development of our policy. We then in 2018 went ahead and formed our SSB technical committee. And that technical committee was responsible for determining what our policy imperatives would be. And so 4 areas were considered: the tax type, meaning what type of tax we would be willing to implement, whether it would be a specific tax or an ad valorem tax. We also looked at the tax base. So exactly what type of beverages we would be considering under this SSB tax. We also took into considerations making provisions for alternatives, meaning allowing certain beverages not to be taxed in order for persons to have that as an alternative, and then also determining what we will do with the taxed revenue. We also conducted in-country consultations. So at this time, between 2018 and 2019, the PAHO advisors came in country and they engaged some of our key stakeholders, and they also used the opportunity to make some site visits as well. Some of the stakeholders that they engaged with were from the Ministry of Education, Ministry of Finance, Ministry of Trade, and then they also had a consultation with Custom and Excise in order to get more information as to how as to the numbers of sugar-sweetened beverages that are actually imported in country. We also held 2 in-country town hall meetings, one on the island of St. Kitts and the other on the island of Nevis. And we used this opportunity to inform the public of the imperatives that the technical committee came up with. What we determined that our tax would be, the drinks that we determined would be our tax base, how we were planning on spending the tax revenue or using the tax revenue when it comes in. We also, in 2019, we held focus group meetings with a number of entities, including our food handlers and agro-processors, the media, government agencies such as trade, and as well as some of our wholesalers and the Bureau of Standards as well. These were important key stakeholders and focus groups for us to be able to speak to share exactly what we're planning on putting into our SSB policy at the time. So the aim of these consultations was to share the findings of the SSB survey, to discuss the imperatives, and to also gain the commitment from the stakeholders to ensure that we had a successful development and implementation of the SSB policy. We took the feedback that we got from those meetings, and we reviewed the policy that we had, and then when we completed that draft, we sent it off to our permanent secretary and chief medical officer for review. And then we also sent it off to the Pan American Health Organization for review. This is the point at which we're at right now. Our policy is still being reviewed by PAHO. We've had a number of meetings with them pertaining to the policy thus far. We've answered their questions. We've made changes according to what they've asked us to. And so we're just awaiting the final report from their review. Now, these are the 4 areas that are being considered in our SSB policy. Number 1, the taxation of the policy to foster reduced public consumption of SSBs. Then we're also going to be looking at placing restrictions on the sale and consumption of SSBs in public and government institutions, such as hospitals and schools. We're also going to be creating public awareness campaigns to advocate for the restrictions of SSBs. And we've also made recommendations for channeling the relevant tax revenues from SSB to the preventative and promotive health. So our next steps would be, after the PAHO review, we'll be finalizing the document, and then we will hold our final multi-stakeholder meeting, which we hope will be able to share that final draft, get their buy-in, and then even if they have 1 or 2 comments and feedbacks, and once we've put that into our document, it would be ready for submission to the cabinet, hopefully by September of this year. So how can CSOs support us in this? First, through health promotion and information exchange. By obtaining information as it pertains to the unhealthy effects of sugar-sweetened beverages on the body and being able to share this with the public, and then implementing any type of surveys or health research that can be done to help to show or to bolster the evidence for this. And one of the things that we appreciated from Lake Health and Wellbeing is that they jumped in right at the beginning of when we started talking about what we wanted to do as it pertains to developing the sugar-sweetened beverage policy. When they approached us, they were quite adamant that one of the things that they wanted to do was to help to sensitize the public as to the harmful effects of sugar-sweetened beverages. And we were really appreciative of that. And because we know of the many hats that some of us wear here in the Ministry of Health, it's kind of difficult for us to concentrate on any one area at a particular time. And so having that support from an outside entity to share this information with the public was beneficial to us. Also, in terms of policy advocacy, building policy consensus, and then disseminating policy positions. Again, we were grateful for the fact that Lake Health and Wellbeing went ahead and they prepared a very comprehensive policy brief, which they were then able to share with our cabinet here in St. Kitts and Nevis. And I can say, coming out of that policy brief, our minister came down to me and had a conversation. What is happening with the SSB policy? Where are you, Dr. Cathy? Because of that policy brief that was sent on to the cabinet. So by creating that urgency and showing that there is community support for the development of the SSB policy, we were able to see an increase in political will. And then just enhancing public support for our policies in general. Additionally, we have resource mobilization and allocation. Again, through Lake Health and Wellbeing, because of their advocacy and their funding availability, they were able to go even a step further, creating the sugar-sweetened campaign, sharing that information with the public. And so they were able to channel finance into the support that we needed for the development and for the sensitization of the public for our sugar-sweetened beverage. And then simply monitoring quality of care and responsiveness. So just giving a voice to individuals who could be affected by the excessive or consumption of sugar-sweetened beverages, representing rights of patients and quality of care issues, and then channeling and negotiating patient complaints and claims. So those are just some of the areas. Some of them are pretty broad, not necessarily specific to the SSB policy, but just how CSOs can support the Ministry of Health in making sure that we get the information that we need out to the public, and also the support that we need in order for us to develop those programs and policies that would benefit the health of the public. And so my final thought, the development of health policies is in line with the overall goal of the NCD Action Plan for the Ministry of Health, which is to reduce modifiable risk factors for NCDs and underlying social determinants through the creation of health-promoting environments, with the target being 20% relative reduction in overall mortality from cardiovascular disease, cancers, diabetes, and chronic respiratory diseases by 2025. Now you might say 2025 is just around the corner, and I do agree. But we are working hard. Although we see a trend of increase in deaths and illnesses related to NCDs, I do believe that if we continue to work to support each other, to make sure that the public understands the harmful effects of the risk factors of NCDs, I do believe that we will be able to achieve this goal. Thank you so very much.
Wonderful. Thank you so much, Dr. Carter, for your presentation. That was excellent. A really nice look at how you've developed your sugar-sweetened beverage policy and how we as CSOs can support you. I personally would just like to say it's been such a pleasure working with you over the last few years and working with your team. All your enthusiasm and support for the work that we're doing is really much appreciated. So we just thank you so much for the opportunity to work with the Ministry of Health. So what I'm going to do now is hand over to Iseline. And so Iseline is just going to facilitate a short Q&A. I think we only have 2 speakers left because I think the others had to leave early. So I think we just have Dr. Karti Maesha, I think, left. So Iseline, over to you to facilitate a quick Q&A and discussion.
Sure. Good morning or good afternoon to everybody, wherever you're at. Thank you again to all the speakers for the presentations. I really thought this was a very informative session. So at this point, we're kind of taking questions from anybody who has them. Any questions on the floor currently, or anything from anyone who might be curious about any of the presentations? So as a recap, we remember we had Dr. Trim presented first on monitoring and evaluation, and she gave us quite a bit of information on measuring success of our different advocacy campaigns and challenges, especially challenges that I believe we can all say we particularly experience when it comes to monitoring and evaluation. Then we had Maisha, who's still on the line. She's still here, kind of giving us the regional view of how ultra-processed foods and specifically sugar-sweetened beverages actually impact the health of our region and the action that needs to be taken. And I think an important aspect of Maisha's presentation was, of course, the challenges that we face, especially in terms of opposition, but the opportunities that also exist out there in terms of building momentum and kind of growing our coalitions. Then we had a presentation from Shelly, who is in Nigeria. It's really great to have that case study. It's always nice to hear about successes, and I think they did a really great job in Nigeria. So definitely lessons learned from there. And then, of course, we had Dr. Catty giving us the government views in terms of the process that government goes through and the things that they consider, and how we as CSOs can help to continue supporting the work that they're doing. So do we have any questions, comments, thoughts, anything at all? Now is the time to share those. If not, I can jump in and share my own thoughts, but also always want to give persons opportunities to share any thoughts or feedback. Okay, well, I think for me, and one of the key takeaways that I had, particularly from the presentations, and I always try to identify trends and commonalities, and I think just kind of key is the strength of coalitions. And that's actually one of the things that we're trying to do right now in the stage and phase that we're at in Lake Health and Wellbeing, the advocacy we're doing here on the ground in St. Kitts in terms of building a diverse coalition. I think we saw it in the Nigeria case study, and also Maisha mentioned that's one of the strengths in terms of building strong, diverse coalitions and building our voice for advocacy. We're definitely trying to do that here in St. Kitts, and it can be a challenge in some ways, but kind of finding that one single kind of unified message and that thing that we can all share in terms of the objective. And I think obviously public health and improving the health of our communities is something that persons are interested in doing. So definitely working on doing better in that regard. Anything from anyone, any other thoughts or comments that persons want to jump in on? Even challenges that you may be experiencing in your own work. I see we have a few persons on the line, names not exactly familiar to me, but any thoughts or comments from anyone? No, quiet crowd. Well, we have like 2 minutes left. So I don't know, Abby, if you had anything, if you wanted to engage in any way. I do think a thought that I had just, I guess, in terms of monitoring and evaluation, I thought that presentation was very, very particularly helpful and useful, is obviously just the struggle we have with identifying indicators. And also, it can be demotivating sometimes when you kind of go along and you're not really sure whether you're actually making an impact or not. I think one of the things what's rewarding for us with our You're Sweet Enough campaign is that on the ground, when we go out, there are people who actually tell us that they hear the jingle, and there are people who sing it and it's familiar. And sometimes it's not very easy to measure that, like to actually measure the number of people that you see in a day who say, oh, you're sweet enough, and who kind of see that. And so, outside of surveying at a particular time, but I think having those instances where just kind of in your everyday and you go out and kind of being recognized for that messaging is very important. So I don't know, we might have to figure out a way to how we can like register those. If, we go and we say 2 people or like 5 people today came up to me and said, oh, hey, I see the work that you're doing. because I think that's kind of informal ways of how we're able to see, okay, we are making an impact, or that the message is resonating. I don't know if others have that experience in their work, in their advocacy, but that's certainly something that we've been seeing, that you could say is, I guess, an informal monitoring and evaluation of the work and the impacts that we've been making. So thank you. So also we have a comment here from Maisha. Oh yes, so yeah, thank you. Maisha said she thinks a very valid point, just in terms of, especially in small community settings, definitely, because we don't always have surveys ongoing throughout like intervals all the time, but we definitely, because we live on a small island, you know, that's kind of how we interact and engage. And people are very open to saying, yeah, I'm familiar with that, even though they may not be as eager to fill out a survey. They would be eager to tell you that it's made an impact on them and that they've seen the information, always willing to engage, and less so to actually fill out a survey to express their views. So that's a challenge that, you know, we definitely see at times. Okay. Well, if there are any other questions or comments, it's 12 o'clock right now. So I will turn it back over to you, Abby. And thank you all very much. I really enjoyed the session. I thought it was very, very informative. Always interested in learning and hearing about the work that people are doing and finding ways that we can support. So thank you all very much.
Wonderful. Thank you so much, Iceline, for your reflections as well, and for leading the Q&A. So thank you so much for your reflections. So that is pretty much it, really. So just to end off by saying thank you. Oh, so thank you to everyone. Thank you to all our speakers, so Dr. Shelly Trim, Maisha Hutton, Shirley Ewang, and Dr. Marissa Kati. I think all of your presentations were absolutely excellent, really insightful, very informative, and quite empowering and inspirational as well. So thank you so much. Thank you to all our attendees for joining us today. It's a Friday, so we appreciate you taking the time out of your Friday to join us. Thank you to the Global Health Advocacy Incubator for all their support, and HCC, thank you always for your support, really appreciate it. Thank you, Danielle, as well, Danielle Walwyn from HCC, for providing the fitness break. And then please complete the feedback form once you leave the meeting. Remember, monitoring and evaluation. So please do complete the feedback form once you leave the meeting. That would be so appreciated. Thank you so much. And then just to say, keep in touch. So we're on all the social media channels, well, not all, but we're Instagram, Twitter, Facebook, and of course our website. So thank you so much. And just to say, if after the session you do have any questions for any of the speakers, then please do let us know. And I'm very happy if you send us an email, and then we can direct your question to the speaker and get an answer for you. So thank you so much for joining, everyone, and enjoy the rest of your day.